Our guest today, Dr. Eric Zielinski, is trained as an aromatherapist and public health researcher. He started his own online ministry in 2014, along with his wife Sabrina, with drericzee.com, to help people learn how to use natural remedies like essential oils safely and effectively. Now visited by 5 million natural health seekers every year, it has rapidly become the #1 source for biblical health and non-branded essential oils education online. An accomplished researcher with several publications and conference proceedings, Dr. Z is a popular speaker and best-selling author. His newest book, The Healing Power of Essential Oils, publishes March 13th, 2018. Highly recommend you run out and grab that. Dr. Z lives in Atlanta with her 4 children and his wife, Sabrina. You can visit Dr. Eric at drericzee.com. Eric, thank you so much for coming on the show.
Well, thank you, Wendy. I love you. I mean, everything you're about, being part of your summits, being part of your podcast. I'm as, if not more excited than you and everyone listening. I just love essential oils. I love what you're doing. I love how we help people together.
Yeah, I love essential oils. I use them a lot personally at home. I took a bath last night. I love using lavender oil. I use some thieves oil from Young Living, I believe. And I'm using essential oils more really craving them, I'm finding. And I think it's really important for people to learn more. That, my listeners are very interested in health and detoxification. It's very important, I think, to add essential oils to your health regimen. So I love that what you're doing, help educating people about essential oils. So tell us why you became so passionate about essential oils.
Wendy, before I did what I'm doing, I was a medical writer. I was providing for my family when I was getting my doctorate. And one of my clients commissioned me to write a series of public health reports on oils. I literally knew nothing about them, like nothing at all. This was several years ago. Now, my wife, Sabrina, she's as foo-foo and beautiful as it comes, and she uses her oils, and she smells great all the time. And I literally just thought they were just foo-foo smelly stuff. Sabrina did, and I marginalized them. Like literally, I'm not going to go play basketball with my buddies smelling like ylang ylang. They're going to take my guy card away. I just couldn't do it, right? So it never was an option, ever. And once I was told, because I had to, it's my job, I was forced to learn, I was like, whoa. And I started reading study after study, hundreds of studies. And I wrote all these reports. I'm like, there's something to this stuff. And then I started doing the evaluation of the different brands and different companies. And then the kicker was literally 99.9% of everything I found online was biased, and meaning financially biased. Like you just mentioned a brand. It's virtually impossible to find information out there about oils without having that individual either sell, represent, or mention a brand. And I'm not saying their information's false, but what I'm saying is, as a public health researcher, that's like financial bias number 101. You don't do that. And so I decided to, why don't we have a non-branded event? We called it a Telesummit. You've done these now, right? And in 2015, we hosted the Essential Oils Revolution. My buddy Josh Axe, my buddy Joe Winger, and it was huge. We had 165,000 people, and it launched me as the go-to essential oil guy. But here's the kicker. Be honest with you folks, I'm not lying here. I didn't know much about oils. I'm the investigative journalist. I'm the researcher. I'm interviewing the experts for my summit, never proclaiming to be an expert. And then people came to me and they're like, Dr. Z, we need you to help us. We've got no one else. Literally, I read over 4,500 comments from that summit. And the one bottom line thing people said was, we need someone to step up that we could trust, that isn't going to sell oils, that's going to teach us. So I went to school. I literally went to aromatherapy school, and I've been studying, learning up until now, wrote the book, did the Masterclass. And so it's been a really interesting adventure. I wasn't planning on it. It wasn't part of my career goals. It wasn't my SMART goal platform. It's not on my vision board, but it's awesome because I love them, and I've found so much use to them. And my wife and I really relate on a deeper level because now I'm in her world more, and we literally now help millions and millions of people, and we're completely non-branded. It's been a wild ride.
Yes, and I only mentioned the oil because I said thieves,
Yeah,
and that's a specific
I know.
product of that brand. I like that one. But
Yeah, but
yes,
you can. But see, that's the thing. I won't
yes,
even say the name.
yes.
Like I've trained myself, and people ask me all the time, "What brands do you use?" I'm like, I'm not
Yeah,
saying it.
I'm not a rep. I don't
Can't
sell
do it.
any of these
And you
products.
know why, Wendy, too? Because I don't say the names of the brands, I don't promote them. I literally have the freedom of speech to say what I want to say.
Yes.
A representative, bless their heart, they're restricted by FDA compliance. So you can't mention frankincense and cancer. You can't say clove and detoxification.
And
You
what's the
can't use
point?
words.
What is the point if
I
you
know.
can't truly educate people? And I think that's what's so brilliant about what you're doing
Yeah.
is, really providing science-based information. I mean, your writing is heavy duty. The amount of research you put into it and the scientific references and everything you're doing. I love that you're educating people about this because that's what I want when I'm reading about essential oils or any topic. I want to see the hardcore science behind that, and you've done that work. And it's easy, like for me, even not myself, I've dismissed essential oils in the past because I really didn't know much about them. I thought it was just like, massage therapists use them or just whatever. It's easy to dismiss them when there's a little bit of ignorance there, when you don't really know what you're talking about. But in meeting you and learning more about essential oils and trying them, I've really been amazed at what they can do for us. And like my uncle right now has stage 4 lung cancer, and I know you've got an essential oils course right now, and you're teaching people about the essential oils that you can use for cancer, people going through chemo. Can you tell us a little about that?
Oh yeah, there's so much. I mean, there really is. A couple things when it comes to cancer, and just in general. Um, I don't know of any other substance in the natural health world, really. And I'm just being real with y'all. Like I don't know anything that is good for symptom-based management like essential oils. Like every symptom, literally every symptom, every side effect you could think of, you could use essential oils for something. And they're safe with virtually no adverse reactions if you use them the right way. So when I think of cancer, the first thing I think about is the litany of side effects that people deal with from A, the cancer itself, or B, from the treatments, from the radiation, from the chemo. So at the end of the day, everyone battling a disease, especially cancer, should be using essential oils, regardless if they're on medication or not. And that's the other important thing to think about too, is and I've been guilty of it too. Like literally, I can count on my hand, and you can tell I have a little bit of a cough. I'm just coming over the flu, but it's life. I'm expressing health. Flu didn't kill me. Didn't have the flu shot. I feel great, right? A little bit of cough. I can deal with it. I can count on one hand how many times my family of six has been on antibiotics the last 10 years. Like we use drugs very minimally. So I'm on the spectrum of, hey, let's do natural first. But I say that to say, Wendy, we're part of this little circle, all these drsoandso.coms and all of our things that we do. It's like if you have an OTC, over the counter drug in your purse, they shun you as like a hypocrite. We don't want to present that to people. Like this isn't all or nothing. And the one thing I really like about essential oils are they complement true integrative healthcare. And that's what I'm all about, integrative healthcare. It's
Yes.
not you go to oils only or you go to chemo. So if you have cancer, you do what you got to do. And the people that we know that are doing really well, they're doing both. They're on immunotherapy. They're using oils. They're taking chemo. They're using oils. Some of them are straight vegan, doing Gershon, and then they're doing oils. They're doing fine too. But I just want you to realize, and this is so important, that it's not an all or nothing thing. And I'm telling you, the research supports it. You always want to use oils with your therapies. It helps chemo perform better. It helps your body react better, helps your body recover. So with that said, just kind of place the groundwork for cancer as a whole. There's so much you could do. And just think about what cancer patients deal with, everything from low libido to fatigue to cachexia to horrible, headaches and pain, like all these different things. All these different things we could tackle one by one by one by one. But as a whole, I just want to paint a picture, and all this is on my website. I actually have a book on Amazon called The Truth About Essential Oils and Cancer that goes through protocols for all these different things. But
Yes.
I want to encourage you all that yes, you should, and I'm telling you, and I know this for a fact. Any oncologist worth her weight in gold will tell you You can use oils and don't worry about it. I get infuriated by the ignorance of some medical professionals that say, oh, don't do it, it's going to hurt. That's not what the research says. That's not what the case studies say. That's not what the countless people that come to me say. And so our friends who are going through treatments have good doctors that say, hey, you know what? I can't say yes or no what to do, but I'm telling you, don't worry about it. You could use your frankincense and just keep on doing what I'm going to tell you to do. And so just so you know, folks, you can fire your doctor. You're not stuck. You need to find a healthcare provider that supports your way of life, because at the end of the day, I don't want you to do things like in shame. And that happens a lot. A lot of people tell me, oh, I can't tell my doctor what I'm doing it in secret. A, I think that's somewhat dishonest. And B, it's dangerous, because you need to let your provider know, especially your pharmacist, if you're doing stuff. Like, there are certain chemicals and oils that can interact with certain drugs. So you want to make sure everyone's, and so I get this, people literally hide things from their doctor. Like, why do you go to that doctor then?
Yeah,
You can't trust your
fire
doctor.
them. I love that. You're fired. I like that.
Literally. And I get it. PPO, PMO, whatever. Oh, I get
Yeah.
it. It sucks that we're stuck in the system, but there are options.
Yes.
So with that said, there's a litany of essential oils, and I'm hosting this masterclass right now. And by the time this airs, what is it? Whatever next week, Saturday, Sunday is, I think March 3rd and 4th, we're having a complete replay weekend. Be sure you guys watch lessons 8, 9, and 10. They're short, like 15, 20 minutes. We keep them short, sweet, jam-packed. Lesson 10 is all about cancer. All about cancer. Lessons 8 is about preventing disease. Lesson 9 is about treating disease. And the whole system before that is just setting the foundation. So be sure you sign up. It's free. Take advantage of that. I list all the oils that you need for cancer. And anyway, we can talk a little bit more about strategies about how to find what works for you. But at the end of the day, I just want you all to know there's hope, and there's a lot you could do. There really is.
Yeah, I'm going to send my uncle to watch the episode on cancer, because he's dealing with chemo and lung cancer right now, and I really want him to use essential oils during his treatments. So talk to us about your book. So you have one of the #1 selling books on Amazon in a lot of different categories. It's doing so well. Tell us about some of the things that we can find in the book and learn in the book.
Oh, Wendy, too? Yeah, I will answer that. Do me a favor and give me your uncle's email. I want to give him access to my course for free.
Okay, thank you.
And everyone listening, okay, honor system. If you're broke, if you have cancer, if you can't afford treatments, if you can't afford my masterclass, I'll give you my course for free. If you can afford it, don't lie. Just buy it. I'm giving away a lot of free stuff for people, widows, elderly on fixed income, single moms. I'm a big believer. I can't outgive the giver. I'm a believer in God's providing, and He's helping me. And we have a lot of people. So anyway, if you're watching this now, email essentialoils@drerickz.com, essentialoils@drerickz.com, and say, hey, I just listened to a podcast. Dr. Z said if I have a financial hardship, he'll give me the course. We'll give it to you. But I'm asking you to please be honest. Yes. Because we get people who lie, and I'm giving away hundreds and hundreds of this. So anyway, I want to hook up your uncle, and this is full access to all the books, all the digital downloads, and everything.
That's wonderful. I love that.
Yeah, and I'm legit. Like, this is legit, folks. Call me out on it. Like, do it. So A, B, my book, boom. You can't see it. Let me see it. I love it. This is like my opus magnum.
Yes.
This is my my baby's baby. Thank God for my wife and kids who just gave me freedom to go up. I live in Georgia, and I just spent days and days in the mountains of Georgia writing this book. I just had to get away. The Healing Power of Essential Oils. Super excited about it. It's like, I'm excited because Random House, Penguin Random House, the largest publisher in the world, picked it up, which is a big thing because it's the first book to really get picked up by a major publisher in the last decade, which tells me something, that oils are more than mainstream. Like, when you have a powerhouse like Penguin Random House willing to put their energy, time, and money behind it, they believe it. And it's a good piece of work. I'm just telling you, folks, it will help you. And it's not one of those like A to Z guides where I'm going to tell you everything about every oil. No, it's actually a health book. I have a whole section on women's health where we cover everything from like menopause, premenopause, libido, pregnancy, labor, delivery, everything. Like there's so many health topics that we have to cover, and I have a whole chapter on autoimmunity. And there's a lot to learn about autoimmunity. What's the cause of autoimmunity? How do you deal with the root cause? And that's the whole point of the book. The whole point of the book is to really be a guide for health and to show you how essential oils can play a piece. And the theme with everything that I do, folks, is you really can't live a McDonald's lifestyle and expect essential oils to help you. And and this one thing I love about you, Wendy, and your work is it's a holistic lifestyle. Everything, how we relate to our children, our work-life balance, healthy sex life, finances, everything affects how we express health. Everything is connected.
Yes, it
And for
is.
those of you who are going to watch my masterclass, be sure you watch the quick start guide because I cover that. Like, it's really important that you are going to die of some sickness if you're chronically stressed because you hate your job. I'm guaranteeing it. It's proven. We can't live under chronic stress, adrenal fatigue. And yes, stress and anxiety and marital problems will affect your health. So it's all about, how do I use essential oils to enhance my life? And I'm telling you, this is really what blew my mind. The effect that essential oils literally have on the primal brain, the limbic system, how it could literally change your mood, how it could trigger genes to increase fat burning, decrease unhealthy cravings, kill cancer cells. It's just so important to remember that most of the drugs that you're taking, that I'm taking, that are pushed down their throat are based off the chemical compounds in plants, which are the oils. So why don't we go back to nature first? That's all it is about, folks. It's like, let's go back to nature first. Let's try it. And then if nature can't solve it, then maybe we need to go to more of a synthetic model, which I'm telling you, 9 times out of 10 people don't need it. If you live a really good holistic lifestyle, so you get sick sometimes. It's not a bad thing. I mean, sicknesses they knock us down a little bit, but they don't take us out. And we got to realize we want strong, robust immune systems. We want to get the flu. We want to get sick sometimes because that will prepare us so we don't get like deadly chronic diseases. So anyway, that's really the book in a nutshell.
Yeah, and I love that you talk about stress. I mean, that's one of the main ways that I use essential oils is stress reduction. I love lavender and I love some
Yep.
of the other essential oils. They just relax me so much and put me in a much better mood. And I use them every day at the end of my day and to begin my day and in between. And I love them. I really encourage people to learn as much as they can and get like a nice foundation of how to use essential oils in their everyday life. Can you tell us about just any kind of really interesting tidbit in your book that the listeners might really, really enjoy?
You mentioned something, Wendy. I think it's really important, like what you do. Um, you have a go-to solution. You have a go-to, what is it? Not a way of life, but you have options. You're not like, oh, I'm stressed, I don't know what to do. I mean, I I do it. And folks, if you're on my masterclass or Facebook, if you get a comment from me, it's me. By the way, it's not like I don't pay someone to comment. And I think it's funny because people are like, are you really commenting? I'm like, yeah, it's me. So I'm looking at hundreds and hundreds and hundreds of comments right now from my masterclass. And one thing that's really breaking my heart, especially older people. And I want to say older people because older people in general, geriatric patients have not had the benefit that we have of the internet, of a mass education, and they haven't had natural health solutions like we have. They've been really inundated, especially baby boomers. They've been inundated since birth with antibiotics and drugs in the medical system. I'm 38 years old. My kids don't even know any other better. They're just like hippies off, like it's awesome. They just don't know oils and probiotics and gluten-free is a way of life. So I'm getting a lot of geriatric patients, not a lot, but several that are saying things like, I don't know what to do. I'm stressed. I can't sleep. I have anxiety all the time. Like you're 76 years old and they don't know how to manage stress and they don't know how to manage anxiety. And I say this not as a criticism, but my heart goes out to people. If that's you, if you literally battle stress, anxiety, skin issues, or anything, and you don't know what to do, you literally are clueless, that's the point of the book. That's the point of my masterclass, is to give you tools. Like Wendy, you're stressed out. You know what to do. At least you know where to start. Open up lavender, maybe create like a little aromatherapy inhaler. We could just smell, put some in a diffuser. It's like the whole point of what I do is to empower people, to give them a fishing pole. So when they need it, they could fish. And the last thing I want And your beautiful daughter, Wendy, last thing I want is for your daughter to get a 104 temperature and you rush to the hospital because you're clueless what to do.
Yeah.
At least you have ideas what to start, and that's what this is about. Like literally, that's what natural health to me is about. Buying the supplements that you sell, Wendy, using essential oils, getting the summits that you offer, getting educated. So when something happens, we know what to do. It's like there's power. There literally is an empowerment when, and you know what? I don't, if I could read something, I don't like, I know it's not like story time with Dr. Z, but I quoted, this is such a powerful part, such a powerful quote that I think really exemplifies why I do what I do and points out to people like the state of health that we're in. I quoted a Medscape study. Let me see if I can find it. Can I read something quick?
Oh, please, please.
Are we allowed to? Okay, cool. Read story time with Dr. Z. I'm all about story time. I got like, I seriously got like 100 kids. I got 4 kids. They're always story time. So this is page 11, part 1 of my book. This is, if you catch this, if you're listening, if you're watching, if you catch this, I'm throwing something at you, this will change your life. It's changed my life. I guarantee you it's part of what's changed Wendy's life, and it's what changes the people that follows us. So a Medscape report shares a shocking story of one physician, just one, who blames patients for the misuse of medical treatments because of the sheer volume of people who, quote, flood urgent care centers seeking care for run-of-the-mill ailments, such as simple ankle sprains, sore throats, or diarrhea. For one day, sunburns, the list goes on. This doctor says, none of us would even consider seeing a doctor for such trivial common matters. This is from a doctor. The physician stated in an interview, I see about 50 patients a day, and easily 75% of them have no business coming into my office. And 80% of those patients are expecting antibiotics. This is from medicine, folks. What this is telling me is that we have become woefully unprepared to just take care of ourselves as a society. We don't know how to garden anymore. We don't know how to cook food anymore. We don't know how to take care of basic things anymore. And I say this not as a judgment, but as a call to action. Like, what do we need to do? Learn. I mean, 150 years ago, you learn or you die. I mean, things are different now. We become enabled. The system has enabled us. And it's why I love what you do, Wendy, because you just empower people with education. And so that's what this is. My masterclass, my books, my website, my summits, it's just to give people power back.
Yes.
And,
Yeah, I love that because it's so important to arm yourself with knowledge and not look at the doctor or worship them or look at them as going to be able to solve all of your health problems, because they're not. They're one person to consult with that can give you guidance, but ultimately it's really up to you in guiding your care, and you have to educate yourself, just like what you do, Dr. Z. You have to educate yourself about alternative health treatments in order to win the game. If you really want to meet your health goals and thrive and prevent disease, it's up to you. It's not going to be up to anybody else.
Yeah. And how empowering is it? I mean,
Yeah.
really, how empowering is it that you could sprain an ankle and you don't have to rush in the hospital? I mean, this is kind of a sad story, but my uncle lives in San Diego, and there's a genetic condition that my family deals with. My wife's family deals with, my uncle-in-law, and that deals with a constricted esophagus, and food gets stuck in the esophagus, which can cause my family to choke. My wife's family. Well, my wife's uncle had an episode where he was choking and he couldn't swallow a piece of food, and he went to the ER, and literally 2 hours later, waiting, the food finally dislodged and he swallowed, and then he went home. Like, what a waste of 2 hours. I mean, how much time do we waste our time in urgent care centers just doing something that A, will resolve itself, or B, that we could fix ourselves? And it's just little things like that. I mean, really, folks, you'll just feel so much more. I don't know, you'll feel more of a man, more of a woman, more of a husband, more of a father, more of a mother. You're just like, I got this. I got life. And then you know who to go to when you need help.
Yeah.
I'm not a financial guru. I know how to do basic banking. And if I need expert advice, I go to a financial advisor. Same thing with my taxes. But, I could get by if I have to on the basics. So anyway, Um, that's what we do. We show basics. And if you want to learn advanced strategies, especially with essential oils, get certified at aromatherapy. It's not for everyone, but those people who really want to take it to another level, or for those people who want to do it professionally, yeah, you definitely need that. But for 99% of the people out there, you don't need certification. Get my book, take my masterclass, get the basics down, start to use them yourself and learn, and you'll start coming up with things that are really impressive.
Yeah, well, tell us some more things. I want to know more about what people are going to find in your book. So what are some of the chapters in your book, and what are some of the things that people might not expect to learn about essential oils?
The big thing, and this is something that is right up your alley, is the onslaught of environmental toxins that we have against us through our cleaning products and body care. And people are now starting to catch on that literally your skin's a sponge, and that your skin is literally the first layer of your first barrier of your immune system. And if you want to be healthy and strong and not get cancer, not get diabetes, not get autoimmunity, you need to have healthy skin. And that means you need to put the right care products on your skin, not drying products, not products filled with chemicals like, propylene glycol or triclosan or other things. So one thing that we have, like, over 150 recipes in my book to show you how to make everything, like everything from your body care products to just healing solutions like for fibromyalgia. So one thing that, I want to encourage you all to do is to literally DIY, do it yourself as much as possible. And I know a lot of us I get it. I'm a dad. I got 4 kids. I'm not like in my Betty Crocker test kitchen all day long making like, stuff. It's like we do what we could do, but there are little hacks and tricks. And, even going to the local health food store and getting a base oil that's non-toxic and adding some essential oils, that's a really quick solution to like a body lotion now, instead of putting whatever junk you're finding at Walmart. I mean, it is so important to minimize those toxins. And cleaners, oh Lord help me, it's unbelievable what's in this stuff. And so if you want to live a detoxed life, toxic free life, it really starts about creating a healthy environment in our home. And that's what it is. I mean, just simple things like everyone listening, watching should stop using hand sanitizer like immediately. Like there's no benefit whatsoever, like clinically at all. And so for people that want to have something on the go in case of like a cut or whatever, a scrape, or maybe your hands do get dirty, or I get it, you're changing diapers on the road. I do that. I could go on road trips. So an easy solution is to get like an ounce bottle, spray bottle, something like this on Amazon, costs like a couple bucks. You fill it up with some water. Actually, not fill, water's last, but what you do is you do 10 drops of essential oil, 10 drops of witch hazel, and 10 drops of an organic grain alcohol like Everclear, because that helps solubilize it, because water and oil don't mix. So you got the witch hazel, the oils, and the alcohol. You mix that up with some water. That's your hand sanitizer. Like that's what all you need. If you want more of a moisturizing effect, you can put 5-10 drops of aloe, 5-10 drops of vitamin E. Like that is all you need. And all oils are antimicrobial to some level. If you want something super high power, you mentioned a blend earlier. Every company has their quote immunity blends, usually includes oils like clove, cinnamon, eucalyptus, rosemary, lemon, orange. Those kinds of oils are super antimicrobial, antifungal, and antiviral. Like literally, folks, you don't need this triclosan pesticide ridden stuff at the store. And I literally ask you to throw it away. Don't even give it to people. Like don't even donate it to the Salvation Army. It's poison. And these chemicals have literally been linked to neurotoxicity, Alzheimer's, dementia, cancer, autoimmunity. It's scary. It frightens me to see every kid at my kid's school with a little hand sanitizer on their lunchbox. It's like, guys don't get it.
Yeah, and especially
So
what horrifies me, that's at every hospital.
everywhere.
Before you go into the room, the nurse has to put this garbage, this neurotoxic, hormone
Yep.
disrupting chemicals on their hands, and then they touch the patient, and they have to do it every time they walk into every single room. It's just, I really feel for nurses and the amount of toxicity they have to put up with just from that alone. But yeah, I mean, like you said, every essential oil has antibacterial properties. You could pick any oil, any smell that you love, and
Yep.
create a hand sanitizer like that. I love it. And also, I think it's so fun to make your own cleaning products and your own beauty products
Yeah.
because fragrance is one of the very, very toxic part of any kind of cleaner or beauty product. And some of these fragrances, they're considered a proprietary information. That
Yep.
word fragrance can have 100 different or more chemicals behind them that's the hiding behind the word fragrance. And so you really have to be a smart consumer, not buy products that say fragrance or perfume in them.
Yep.
Purchase products or make products that have essential oils in them, and then you know that they're totally safe for your body.
You know, it's interesting. A mutual friend of ours, Steven Ezel from my Greenfills, he did a study that, and he does non-toxic laundry solution. Give him a shameless plug. Great product, by the way. And they did a study. They test, I forget how many people, but they gave people like a sniff, but a visual test. Like, okay, they gave them two different sets of rags. One rag, which was absolutely the dirtiest looking rag you can think of, a white rag that looked like some mechanic just wiped his hands, which he did, but they made it smell beautiful and clean. And then they had a completely white, perfect, crystal clear rag that had no smell. Most of the people chose the dirty rag that smelled good over the clean rag that had no smell. And that's the reason why, folks, your Tide and your laundry solutions have that smell, because that's what people want. They want the fresh fragrance. And so don't be duped. People are basically, companies are capitalizing on our, it's like an evolutionary instinctive drive towards smell. I mean, at the end of the day, males will go toward female animals with pheromones, and plants, pollinators will be attracted by the ones that are more fragrant. I mean, seriously, look at the girls at the bar. The guys are going to the ones that smell best. It's just how it works. Smell attracts. It's just our nature. But you got to be careful. You want the real deal. And the cool thing is, I guess cool. It's two-edged sword. Like, once you get to your place, and you know this, Wendy, I know you know this. Like, once you kind of detox your life, you have zero tolerance towards anything toxic anymore.
Oh,
It's
I
like,
can tell the difference in 5 seconds. You don't have to tell me. I know if it's an
oh,
artificial fragrance or it's an essential oil natural fragrance. I know just from training myself, and I don't know, it's a sensitivity thing. And women have 10 times more
yes,
sensitive smell than men. So women, I don't know, they're just much more in tune with smells than men are. So you've got to protect your family and be the
yeah.
one to sniff out these toxins and purchase the products or make products that are better for your health and your family.
And I would suggest that if someone listening and watching can literally go into Joann's or Arts and Crafts Michael's store and not get a headache and not get irritated, that because you're suffering from toxic overload. Your body is so insensitive to it. Um, Once you clean your body out, you can't handle that stuff. It's just, I just like, I used to smoke. And it boggles my mind how I remember being at like the airport smoke bin, like this cesspool of smoke, and these 50 people in this 100 by 100-foot room just smoking. I remember being there feeling totally fine. I can't even walk 100 feet near that place without coughing now. And it just, you get hypersensitive to this stuff, which to me, I see that as also a layer. Like, you really, you should feel pretty bad going to McDonald's afterwards. You shouldn't feel good. And for people that go and they don't, again, I don't have any proof to this, but man, man, your body's adapted,
Hmm.
and you need to readapt your body. And so with that said, folks, give your body time. And as you kick these chemicals out of your life, you will find your body craving good, healthy everything, foods and drinks and smells, and your body will repel everything, because that's, again, your evolutionary instinct is to repel the toxins. But because we've been given toxins since birth, our body's adapted to it. I mean, otherwise everyone in LA would just be wearing smog masks because they couldn't handle it. Our bodies are so adaptive. So anyway, just think about that when you're living this lifestyle, because it's unbelievable what our body will do if we give it what it needs.
Yes. Yeah. Well, Eric, thank you so much for coming on the show. Why don't you tell us a little bit more about your course that you have? So, we're going to be publishing this podcast, so it'll be in time for people to be able to take advantage of your replay and your course. It'll be totally free. So, tell us what to expect.
Yeah, we have 10 lessons. It's a 10-part video masterclass. We cover everything from aromatherapy history to how to properly inhale essential oils, how to ingest them, which, by the way, it is safe to consume essential oils if you do it right, how to apply topical salves. And then we cover all the DIYs, body care, home care, cleaning products, cooking with oils. And then we end with advanced strategies and protocols like cancer, diabetes, and other ailments that are really just common that we could help people with oils. So take advantage of it, folks. It's free. We have over 160 some thousand people signed up right now. We expect well over 200,000. We're helping a lot of folks join the mission, because at the end of the day, I don't want you to be getting your essential oil advice on Pinterest. That's what a lot of people do. And bless their heart, a lot of that is fun and foo-foo, but man, a lot of it's unsafe. I don't want you to be taking 20 drop morphine bombs. You could hurt your liver. So we cover that kind of stuff in my masterclass. All safe, all evidence-based, and you are going to love it.
Yes, and everyone, I highly recommend. Eric is the go-to guy for essential oils and learning about non-branded use of essential oils. All scientifically, all the scientific references are there for everything that you're talking about and writing about and teaching. And I really encourage people to, if you don't know that much about essential oils, or you're just dabbling, you're curious, to learn about them, because they're a very important aspect of approaching your health naturally. It just takes a little bit of, investment in your time and effort to learn about that. And then for the rest of your life, you're able to utilize what you've learned to help address your health issues naturally. And I think it's really, really important aspect of, being healthy. So Eric, thanks for coming on. And everyone, if you want to learn more about essential oils, go to drzee.com. It's drericzee.com, correct?
Yeah, drericzee.com.
Yes.
And you can pick up my book, healingpowerofessentialoils.com, available everywhere books are sold. I think Amazon's got it for under $12 right now, which is like a super sweet deal. So join the group. We're helping lots of folks.
Yeah, and where do they learn about the course? Where do they go for the course?
You want to post a link or?
Yes, I'll post a link in the show
Yeah,
notes so you guys
yeah.
can go there. And so I hope to see you guys there. I'm going to be there for sure. So join us. And everyone, thanks so much for tuning in. I'm Wendy
Thanks, everyone.
Myers. Yes, I'm Wendy Myers. You can learn more about detox at myersdetoxtoxins. And if you like what you heard today, take 2 seconds to leave a review on iTunes. That will help me help more people. When they search for something, they'll be able to find me more easily. Thanks for tuning in today, and have a wonderful day.